Um, Good afternoon, everybody. It is a great pleasure to be here sharing with all of you this important topic. On behalf of the National Hispanic Medical Association and the National Hispanic Medical Association Phoenix Chapter, in collaboration with LatinaStrong, we are here to present you about what are the advocating for Latinx community from the grassroots. It is a real pleasure to be here. My name is Ricardo Correa. I am an endocrinologist based in Phoenix, Arizona, the fellowship director and director for diversity at the University of Arizona in Phoenix. With me today, there are three amazing people that will share their perspective from different areas. They have been great leaders in the community. They are working very hard to make a new world for the Latinx community. And it's a real pleasure to share this panel with them. First, we're going to hear from Annabelle Castro-Thompson. Annabelle is a nurse practitioner that has dedicated her entire life to help the Latino community. She is the Senior Vice President for Health Equity and Equality Health. And she is part of the board of LatinaStrong. She has been doing amazing jobs from every single point, and she will talk to us about how to be a strong advocate from the standpoint of the healthcare profession. With me also is Hector Araujo, who is a manager leadership community of Anti-Drug Coalition of America. He's another amazing person that has been from occupying several political positions and has been in all of his positions advocated for the Latinx community. He's part of the men's group of LatinaStrong and has been very strong developing the strategic partnership for the organization. And finally, we have Petra, who is the CEO, president, and founder of LatinaStrong Foundation. Petra is a nurse that has been advocating for Latinos and Latinas since she was a kid. She has been amazing in the community. She's very well known in the Phoenix area, and she has this passion to advocate for others. She has made a really good change in community, and she will tell us in conjunction with Hector how you can make a change in your community from different perspectives, from the political and leadership perspective, and another from the non-for-profit organizations. So it's very, very interesting. So we will have a different perspective. So if you have any organizations that you're going to start, or you have any idea about helping the community, these are the people that can help you build that. And this is the purpose of this panel, to tell you about how we as a person, we as an individual can work to help our communities, specifically the Latinx community. Without any further, I want to introduce Annabelle Castro-Thompson so she can give us the perspective. Sorry, before we begin, let me just give some housekeeping items. Please, after the presentation, we will answer all your questions and answer. So please start writing your question immediately in the Q&A section that you can see in the bottom of the Zoom. Type your question there, and then at the end, I will make sure that all the questions are answered by our panelists. For all the participants, please mute your microphone and video meanwhile the speakers are talking. The recording will be available next week at the NHMAMD.org webpage. This is a safe space, and I want that everybody feel that they can share their own perspective, and then our panelists can answer them. So without now further ado, I would like to introduce Annabelle for her remarks.
Thank you, Ricardo. It is my pleasure and privilege to be joining you here. I know that NHMA is important to you, and it's important to us in the community, and it's also important to LatinaStrong. I just want to say, and I want to start by saying that I'm a nurse practitioner. And so from early in my career, I've noted that going out into the community and doing health promotion and health education from the grassroots is probably one of the most important things that we can do as healthcare providers and as people that champion health in our communities, particularly the Latinx community. And so I'll start by saying that in our healthcare system, healthcare given is not always healthcare received. Let me say that again. Healthcare given is not always healthcare received. Why? Because we know that challenges with language, with health literacy, with cultural understanding, and with the social determinants of health socioeconomic factors that impact your life have created a large health inequities in our community, particularly for a growing portion of the population. We tend to see that health inequities exist in poor and underserved communities, and we have to find a way outside of the healthcare system to engage these populations. The worst thing we can do is that when we tell people to think of health, that they think of a doctor, right? Because by that time, disease has already taken hold. And so we need to envision in our society and in our healthcare system, how do we engage patients and how do we provide, and not just patients, but I should say members in our community, how do we provide opportunities for health promotion, for prevention, so that people don't have to get to a disease process that now we're trying to solve for and we're trying to manage. And so I'll start by saying that I work as Senior Vice President and Nurse Practitioner at Equality Health. And what I love about Equality Health is that we exist to close healthcare disparities. What we are doing at Equality Health is we are delivering care through the lens of culture. And so what that means for us is that when we envision health, we have 4 foundations that we have that are part of our healthcare system. The first one is there's cultural integration. We understand, and the literature has been telling us for a very long time, that culture has real life implications in the life of people, and it's at the heart of utilization, prioritization, and prevention in certain populations. And I will tell you that that's not more true than in the Latino community. Why? Because we have certain preferences, certain beliefs, and certain values that make us engage the healthcare system perhaps differently than some other people. In addition to that, we need to do cultural integration, and we do it at Equality Health. And what this means is that the social determinants of health need to be proactively and systematically engaged from, and it should be done by the providers. Providers in their practices should be assessing whether any of their patients have food insecurity, transportation insecurity, housing insecurity, and other things. Because what will happen is that if we don't know that our community members, that our patients have these insecurities, then we won't know why they're not able to follow the plan of care. Oftentimes, when we don't have basic necessities, then medicine becomes a luxury, and medicines are hard to approach. And so we need to make sure as healthcare individuals, as healthcare systems, that we are engaging the community and that we are creating those bridges to community. And I'll talk a little bit more about that. In addition to that, we need to have profound member activation. And when we do it, whether we do it digitally, whether we do it in the community, we need to ensure that the information that we're providing is culturally relevant, that it's linguistically appropriate, that it's easy to understand, that it's action-oriented, and that it happens at precise intervals. Why? Because the last thing we want to do is overly engage our patients and that they turn us off, or our members. And then last but not least, there's a component of what Equality Health is doing in the practice, that we're giving them operational efficiencies so that the providers, the doctors, and the nurse practitioners, the PAs, can focus on the person while successfully successfully doing value-based care. So I will switch a little bit now, and I'm actually going to go into grassroots efforts and why they are important. One of the things that I do at Equality Health, aside from the leading the cultural care model and our approach to social determinants of health, I also lead community engagement. And community engagement to me is doing grassroots efforts. That means that you're doing health events, that you're doing health festivals, and that you're taking every opportunity you can to do health education and health promotion. And so what this means is that you participate in town halls, you do virtual opportunities such as like this, but that you also go out into the community. The best thing that we can do as Latino leaders in our community is we need to be present, we need to be visible, we need to be approachable, and we need to be providing the best information. And there are specific ways in which we can do it. I will do it. I happen to be privileged to work for a company whose ideals mirror my own, that we have to be engaging Latino populations from the cultural perspective, assessing and addressing the social determinants of health, and making sure that the providers have the tools to better serve their members. But I also feel that it's important to go into grassroots and to do it well. There is a saying in the Latino community, and also it's used in other communities such as the African American community and the Native American community. And the saying goes like this. It says, I don't care what you know until I know that you care. Okay? I don't care what you know until I know that you care. And so one of the best things that we can do as healthcare systems and as healthcare providers is make sure that we earn the trust of our populations and that we earn the respect of populations. And so this means that you are constantly out in the community so that the community understands what you are doing on behalf of the patient and how you are transforming healthcare for their design. Lastly, what I will say is this. I'm also a past president of the National Association of Hispanic Nurses. We are great friends of NHMA. And one of the things that we know very well in NAN is that our healthcare system is not equitable, it's not accessible, and it's not affordable. Okay. And some of the reasons for this, that could be a whole other presentation and a whole other discussion by itself. But what is clear to us at NHMA and at NAN is this, that there are certain things happening in our countries that are creating more of this gap that we are seeing in health. The first one is that population shifts are changing our community and practice makeup. And so what I'm trying to say with this is that we don't have enough providers that mirror community served. Our healthcare providers, for example, if you look at physicians, Latino physicians make up 5.9% of the physician population. Conversely, if you look at the nurses, we make up 6.1%. And so we don't have culturally competent providers that can meet the needs of populations. So when I show up into the hospital, or my grandma shows up into the hospital, and if she's monolingual, and if she has certain values, certain beliefs, and certain preferences, the providers that are probably going to service her will not know this information. And so this creates a disbalance. The other thing that we are seeing is that there are widening health disparities, and this is costing tremendously in our healthcare system. And so the thing is that when we have a patient inside the practice or inside the hospital, by the time you release them back into their community. And so some of the things that we truly need to do from a healthcare perspective is make sure that when you have a patient in your practice, when you have a patient in the office, when you see a member in the community and is surrounded by community, let's make sure that we not only educate the member or the patient themselves, we need to be educating everyone around it. Because why? Because your support system will influence your actions and your decision making. And so if we do not take the time to educate the family, guess what? Once they get home, the family is still going to have influence over the patient, but now because they don't have the right information, they're not going to influence the patient correctly. I will stop there, but I want to say just a few things. I am also a member of the LatinaStrong Foundation, as is everyone here on the call and every one of the presenters. I am a firm believer that Latinas and women have a vital role to play in making sure that our families are healthy, that our communities are healthy, and that our society is healthy. And so I truly believe that engaging, educating, and empowering women is one of the ways in which we're building a better community. And if we're doing it culturally appropriate, linguistically appropriate, taking health literacy into account, and we're assessing and addressing the social determinants of health, we're probably going to do better. I will stop there and I'll take questions later. Thank you so much for the opportunity.
Thank you so much, Annabelle, for this amazing presentation, and so inspiring to see that really there is so many things that it's happening in equity, health equity, and that one of the things that you mentioned is empowering the Latinas, because they are the leaders of the family, to take care of them and take care of their patient, of their family. So I think that this is it's an amazing, and I have in the question and answer some questions for you, but now let me jump to Hector and Petra, so so they can share more about their experience in advocating from political standpoint of view and from the non-for-profit standpoint of view.
Beautiful. Thank you, Dr. Correa. Can you hear me with a thumbs up, team?
We can hear you, but we cannot see you.
Awesome. Awesome. Well, welcome everyone. And thank you so much for making the time to join us today. And Dr. Correa, Ariel, and the National Board of NHMA, thank you so much for hosting us and creating this space for us to articulate what we do here in the state of Arizona, some of the best practices of what we've learned, and to follow up a little bit of what Annabelle was talking about, team. I'm going to be discussing, when she mentioned the needs of population, I'm going to do a little breakdown of what our population looks like here within the state. And what I mean by grassroots organizing in our particular community. So what does that even mean? We hear that a lot about grassroots organizing and reaching out to our communities, and what does cultural competent approaches mean? And so let me just give you the definition that I operate off of from a philosophical approach of what grassroots organizing means to me in the Latinx community. And I will be sharing this one pager that we're sharing on the screen here with all of you as well as a resource. It's got hyperlinks to different studies and references to everything that I'm mentioning today as well. So just a quick introduction and overview of what this is. So grassroots organizing in Latinx communities is rooted in relational and multi-generational collective experiences in resistance and resilience. The Latinx community in the US is equal parts diverse and complex in historical, socio-political, and cultural roots. In the last decades, the ever-growing consciousness of predominantly Spanish-speaking identity in the US has reached a higher awareness in the larger fabric of the US identity and society. So self-identifying Latinx communities have begun organizing on major issues to address structural and environmental barriers to prosperity in the United States. And this is what we'll trickle in a little bit later why LatinaStrong came to be. We are an incredibly diverse group, so encompassing multiple countries and territories of origin. So not just because we are a border state to the country of Mexico, so not just thinking about Mexicans, but also Puerto Ricans, the Caribbean, and Central America, South and Latin America, as well as all races. So we also self-identify as Hispanic, Latino, Latina, or Latinx, all depending on the country of origin, our language, social groups, age, and a handful of other things that can consist of why we identify the way we do. And just to share a little bit about our particular state of Arizona, a new report from the Bank of America that came out in 2020 says that Latinos have contributed to $92 billion to Arizona's gross domestic product, $92 billion. And the contributions are most prominent in education and healthcare. So 16.9 of Arizona's Latino GDP goes into education and healthcare. Finance and real estate is about at 12.9%, and professional and business services at about 11.8%. And these are some of the 8 states in the United States that are home to approximately 3/4 of the Latino population, including Arizona, which Phoenix, according to the latest census data, is now the 5th largest city in the nation. California, the state of Florida, Illinois, New Mexico, New York, and Texas round us out as the top 8. And these states have a Latino GDP of $2 trillion. And according to this study, if that figure were to be separated into a country of its own, that GDP would sit at the 8th largest in the world, above Brazil and South Korea, which is very, very impactful. And the reason why I even share these numbers from an economic perspective is a lot of the times when we're going to get into this grassroots organizing, some of the business partners that we tend to collaborate love to hear the economic impact and the value of the Latino purchasing power. And so that's the reason why I'm sharing these numbers when we're talking about grassroots organizing. And so what are some of the best practices that I have learned through our experience and journey in organizing Latinx communities? Now, I'm using this as a broad lens. A lot of this comes as Ricardo, Dr. Correa had mentioned earlier. A lot of my experience comes from my political involvement in the state and also nationwide. But I feel like a lot of this can be translated to any of the work that we're trying to do that look at reaching out and working with our community specifically. So the first one I put on there is authenticity. We must establish an authentic voice in the Latinx community. Many Latinx communities draw on their shared experiences. In example, immigrant experiences, bilingual upbringings. Secondly, the second prong there is community resources. There are many community organizations that support Latinx communities. These are important resources to sharing a message to specific constituencies. Latinx medical leaders that we're trying to talk to from a legal perspective, from business organizations. So keeping that in mind, depending on who we're trying to approach and the language that we're bringing to the table when approaching these organizations or community partners. And then looking at community leaders. Many Latin communities have key stakeholders who are influential voices and may be effective allies to your coalitions. So whether in business, in politics, or faith leaders, to identify those that align with your mission and how you reach out to them to start figuring out how to work together. Also looking at media. Latinx media is a big force in the narration of Latinx livelihoods and Latinx perception. They also have a direct line to Spanish-speaking communities via mass communication. So for example, here in the state of Arizona, we look at Spanish radio, La Campesina, Univision and Telemundo are massive partners here in the state of Arizona as well. So looking at how these conglomerates also have the ability to share the narrative and do storytelling in our communities, to share the great examples of work that are happening in communities, but also bring a light to the needs of our communities. And then also inclusivity. Latinx communities are regionally diverse as they are culturally diverse, i.e. again, like I mentioned earlier, Mexican Americans in California and Texas are different than Cuban Americans in Florida or Puerto Ricans in New York City. So we must be inclusive and understand the sensitivities that certain communities may have on specific issues, like immigration, foreign policy, education, but level setting and understanding that not everyone may think the way that we think, and how do we approach that message in a culturally competent way, but also an inclusive way, knowing that people may think differently than we think, regardless of the communities that they come from. So understanding that and creating a narrative and a message when you're reaching out to communities. But here's the most important part to all of that ties it together. It's really neat for us to believe that we have all of the answers and that we believe we have the solutions to all the issues that our communities face. But the real key to all of this is, how do you create a space where you can co-create solutions to these issues? And that's by doing what? Actively listening to your communities and not telling them what they should know, but listening to the gaps where they may exist and how we can help fill those gaps. So by storytelling is a huge part of our cultural practice among our communities. They offer unique insights into the unwritten history and the common struggle our communities face. So we have to keep that in mind and keep that in real terms, that we may have access to certain privileges that our communities don't, but understanding that we have to create the spaces to listen to what that is, so we can create, again, culturally competent curriculum, outreach programs, whatever it may be that we're trying to achieve, reaches the folks that we want them to. And so let me just give you a little bit of numbers by the state of Arizona, but particularly by Phoenix, by the numbers. Phoenix, where we're centrally located. So about 42.6% of people in the city of Phoenix identify as Hispanic or Latino. 42.5% identify as white or non-Hispanic. 7.1% identify as Black or African American, 3.8% identify as Asian, and 2.1% identify as American Indian and Alaska Native. And the reason why I'm sharing these numbers is so you can look at the diverse populations even within our city alone. That's not even talking about the greater part of the state. That's just looking at a particular region in which we're having the most influence as of right now. And so I wanted to share those numbers with you because that's what we look at as well when we're looking at what type of programming do we want to put on, what type of curriculum do we want to create, what type of panels do we want to have in regards to discussions, questions, things of that nature. So I also put down here, it's a little outdated in reference to the 2017 Pew Research study, but these are the top 10 U.S. metropolitan areas by Hispanic populations according to that study. And I wanted to share that with you, depending on where you're located within the country where you're tuning in from today. Just how close you are to these, or maybe some of you may live in some of these metropolitan areas, but this is where you could reach out to us and talk to us in more depth about best practices, or we can talk about it later in the Q&A about some things that you might be seeing in your communities. And then we can share some more concrete examples as we move forward about what we're doing and how we're doing it and how it may relate to what you're trying to do back home. So that being said, team, thank you very much. And not only am I a part of CADCA when Dr. Correa first introduced me, but I'm also a part of the LatinaStrong Men's Board that works as an advisory capacity to the wonderful women that run the organization. And the reason why I've joined the Men's Board is because some of the most influential people in my life, and the only reason I'm alive today and have been introduced to the world, is because I came from a woman. And I am also a sibling of 7 other women, and I have 7 sisters. And so women have played a very important role in all aspects of my life, in my upbringing, in my development, in my lens in which and how I view the world, the influence that they give to me in today's day and age. And not just, it's cool to say that I've accomplished all these things and done all these things, but I can promise you that none of those things would have been accomplished if those women weren't behind me. And not even behind me, some of them even leading me. So that's the reason why I've joined this board, because without healthy women in our lives, how can we claim to be healthy and holistic in our approach to what it is we want to do and contribute to our community? So that's just a little bit about who I am. Without further ado, team, I just want to introduce to you our wonderful CEO and president of the LatinaStrong Foundation. That is one of the wonderful women like Annabelle Thompson that helped lead me as well, Miss Petra.
Hello.
Oh, there's some echo.
Good afternoon.
So now it's a great pleasure to introduce Petra.
There you go.
Yeah, it's to continue sharing your experience. I think that Hector talked a lot about the grassroots and his experience on this, but I want you to share about your experience in building this non-for-profit and how they have grown so much that you are such an important person in the Latinx community in Phoenix.
Thank you. So the question asked is how I began, how LatinaStrong began. And ironically, it was at a National Hispanic Medical Association conference in DC. It was 2013. And at that conference, everybody talked about the Obamacare. But and the EMRs, you're converting your medical records into the EMR system. But what wasn't talked about was how are we going to educate on prevention, right? More Latinos were going to be on health insurance than ever before, but nobody was talking about how are we going to educate them on prevention, right? Family history of diabetes, cancer, Alzheimer's, Hashimoto disease. Who was going to educate them on all of that? So I got together with a couple friends and we spoke about how can we empower the community? And so we all started talking to each other about, well, I'm LatinaStrong, you're LatinaStrong. And that's how it all began. That's how we started LatinaStrong, was how can we educate on prevention? But before I should have started, was my passion has always been bridging healthcare disparities by giving people hope, providing a culturally relevant education, resources, and solutions. For as long as I can remember, that has always been my passion. So LatinaStrong really aligns on my passion, my purpose, who I am, and the value I can add and bring to the community. A few of the examples that we created, thank you, really is bringing together like-minded people, bringing together Latino health experts, leaders. Our focus is the social determinants of health. So whether it's housing and banking and, access to care, mental health is huge right now and a huge part of LatinaStrong. So we do have some behavioral health professionals as well. We have educators, nurse practitioners, doctors, attorneys, we tap a little on social justice, physicians that are actually educators out there. And I would have to say, we have a couple Latino health experts that are constantly in the radio and on the news, not only in Arizona, but in California. We try to empower individuals that are influencers in the community, whether it's professional athletes or educators. We have to go to the people. That's so important. And we also believe healthy lifestyle starts at home. So here we are, empowering, inspiring, educating the Latinas. And one of the things is the statistics show that 86% of the Latino household decision-making come from the women. So what better way than to empower the women? When people approach us and say, well, LatinaStrong, do I have to be Latina to be part of the organization? And we always say, well, absolutely not. You have to just believe in the mission. And also, that is why we created the men's board, because what men would not want the women in their lives to be at their optimal being, body, mind, and spirit. And that is why we created the men's board. So the COVID year, so January 2020. But I do look forward into seeing the impact they will make as we collaborate and do things in the community together. One of the examples I can give you from a grassroots perspective is that we have a lot of Major League Baseball families and players that are a part of our organization. And during February for Heart Health Month, we would go into the community with the players. So all of us will wear red shirts, LatinaStrong Comunidad shirts, and we had a local artist do the artwork on the shirt. And we would go into the community and educate heart health with the players. And you'd be amazed of how many millennial males wanted to get their blood pressure checked because of the fact that the players are there and they were influencing these young men on the importance of heart health. Another thing we've done is we do Salud y Arte. We feel like it's really important to utilize art because we're visual people. And so we incorporate some of the local artists, and we did Heart Health Month where you could paint on a cup or paint on a canvas. And Dr. Montes would talk about heart health at the same time that we're, painting, it could be a heart, right? But we continue to do creative things. I strongly think that we all need to collaborate. I'm a firm believer that when aligned organizations that mission align, collaborate, you'll touch more lives, hands down. Our world is small, and we all need to help each other to reach more people in the community. So with that said, Dr. Correa, thank you for having conversation with us. And I'm happy that you had the chance to put Hector and Annabelle on the platform to talk about LatinaStrong and talk about our grassroots efforts and the importance of our men's board. Thank you.
Thank you so much, Petra, Annabelle, and Hector. It has been a great inspiration to see what is everything that is happening in Phoenix and how can others can imitate. So please, if you have any question, put your questions in the Q&A section. I know that many people in the chat has been saying thank you, great webinar. I hope that I can bring more of my students. So the webinar will be record and you can access that at the nhmamd.org. So meanwhile, we're waiting for some questions. I have different questions for all of you. So the first one is, all of you have a background of being Latinx, Latino descendant. What you can say to the ones that are not Latino descendant, but they want to help the Latino community? How can you give some recommendation to empower themselves that they can also help the Latino community wherever they are? Oh, Petra, you are mute.
The one thing I would say is you want to empower the people that have the trust of the people. So I think that's one thing LatinaStrong does very well, is that we have the trust of the people. So I would say anybody that's trying to reach the Latinx community, you need to you just need to empower the people that have the trust of the people.
And I would add to that, Dr. Correa, I need somebody to mute themselves. Okay, I think we've eliminated the echo. Perfect. I would say I'm a firm believer of volunteer. If you don't like what you see in your community, volunteer. Whether you can speak the language or whether you're of Latino descent, it doesn't matter. I think volunteering at a grassroots level is beneficial to the person volunteering and to the community receiving. From my perspective, the Latino community is so gracious and so grateful that even when people do not speak the language and they're not of Latino descent, I think people are grateful for the opportunity of being served. In addition, I would say, I think as healthcare providers for the membership of NHMA, and even if you're not in healthcare, I think we all have a role to play in advocating for the community, right? And so whether it's the Latino community, the African-American community, or other underserved communities, I think for some of the reasons that Hector outlined for us, we need to be advocating so that the systems recognize, right, that there's not equity in some of the systems that we have. We need to continuously be advocating so that the healthcare system becomes more accessible, more affordable, and more equitable. And we can do it within our system, within our job. We can do it as healthcare professionals within professional organizations, or we can do it as individuals. And especially, we should do it in our home, right, to create greater community. And so I think there's different levels, but the fact that people want to engage the Latino community is just wonderful, and just find an avenue to do it and give back.
So we have one question from the public is, what is the biggest mistake you have seen when trying to make grassroots impact?
Yeah, team, I'll take a stab at that one real quick here. So just to give you some one example, and the reason why I did mention it early on when talking about grassroots organizing is that we have to move away from this one size fits all approach. And then also not just the one size fits all approach can get us into some trouble. As I mentioned earlier, that the Latinx diaspora is very diverse. Even just the folks on this particular call don't all come from Mexico. And so how do we address and speak to the needs of all different communities? But then also the biggest part that I tend to find in grassroots organizing when we're reaching out to community partners is a lot of folks are either heavily competing against each other and attempting to reinvent the wheel instead of collaborating with one another. And so we pull away from, so when we think about Latinx resources that are set aside from conglomerates or businesses, their marketing dollars or their outreach effort dollars, that's a small pool every year that are allocated to Latinx efforts. And so then when all of us are competing for the same dollar, and each of us are only getting a little bit and having a very minute impact, when if we just were to collaborate, we're all doing the same thing, team. And if we were to collaborate and legitimately become a team, what does team stand for? Together, everybody achieves more. So when working together, we have a greater impact. And so what I find a lot of the time is I'm actually doing a lot of convincing in our own communities how about we should be working together as against each other. And so that's what we have to start breaking down the narrative and the walls in our own communities and the own silos that we create from a business perspective, nonprofit perspective, is how do we begin to create together, look at what our emissions align, and just how do we truly collaborate in moving forward if we're doing the same work. And so, for example, to answer that question specifically, when I was in the state of Virginia, we were working with a particular community that wanted to provide free vaccinations and mammograms and other things for communities that otherwise didn't have access to it. And so they set up a great event where they said, if we take everything to the middle school where the children go, then people would just show up. And so they built this phenomenal one day, access to all resources that otherwise you wouldn't have if you didn't have access to healthcare. If you come to your middle school, you'll have these resources available to you. But what they forgot was not everyone has a car. Not everyone can use mass transit. And so there were all these vendors and providers, but maybe 20% of the membership that they thought were actually going to show up showed up because they forgot to think about the holistic approach to the real lives of people and the materialistic reality of their lives, that not everyone has the resources that you have to get to where you want to. And so when they thought about that and we moved to the next event, they collaborated with Lyft and other programs and service providers that could provide free rides to folks that wanted to come participate to these things that otherwise they couldn't. And then also changed the time frame of how long it was being hosted and when it was being hosted, because you can't host something when we know that sometimes our community members have 2 to 3 jobs to try to keep a roof over their head and food on their table for their families. So what does that mean? That most of their afternoons are taken up, or they may only have a small window. So one day, one-off events may not be the most beneficial approach to collaborative efforts in communities. So that's just one small example, but things to think about and think about really the holistic approach to what it is that we're trying to do.
Go ahead, Annabelle.
Hector, that was fantastic. And I would add to that, when we go out in the community and we do grassroots efforts, let's not forget about the continuum of care. So one of the things that I like to focus on, right, if we are going to be doing, let's say, mammography, right, then let's also have those resources for the women that are going to be diagnosed, right, with breast cancer, and where are the affordable treatment options and diagnostics, right, in the continuum of care, so that when we go out into the community, we don't create more problems for people, right? We're going to be diagnosing something, we're going to be providing education. Let's also make sure that we provide the resources in the community that can assist these members, right, so that we can create a holistic approach to disease management and to the resources that we're giving them. We also need to identify where does somebody or is there a local effort that's bringing together all these community-based organizations so that we can connect the patient there, right? Let's teach people how to fish, right? Not just give them fish, let's teach them how to fish so that when they have a need, they know where to go, where to intervene, and who can assist them so that they can continuously engage those resources and make sure that they serve their needs. It's all about holistic health.
Thank you so much for sharing that. I think that that's something that I realized a little bit late. It's like all of us, and something that Hector mentioned, is that all of us are competing for the same thing. And then if we divide it, we will never achieve. So that's the reason behind partnering NHMA Phoenix Chapter with LatinaStrong, because at the end, we are looking for the same thing. We are looking to improve the quality of care of our Latino population. So I think that that's basic, is trying to find in your community somebody that's doing the same and see how can both have the same mission and partner together. Because if not, this is what happened. I always say that this is what happened with the Latinos. Like everybody want to have one part of the pie, but they never look at the completely the entire pie. So, oh, I'm doing this, and then the other in two street there, 2, 3 further, they are doing the same thing, and then the same thing, and it's not really helping. It's just trying to get your name out and not helping the community. So I really appreciate that. There's one more question, but before the other question, I want Petra to comment about your besides LatinaStrong, you're very into art and Latino art in Phoenix, and you have a place called Fridas Garden where people can go have a coffee, can share experience, and it's in an environment where you have the feeling that you are in Latin America. So can you talk more about that place and how that place has helped your efforts in the grassroots in Phoenix?
Yes, thank you. Like I mentioned, my passion is, providing resources and education. And our mission, it's called Fridas Garden. It's a place to grow. It's a community event space where we work with community partners to influence growth through art. Our vision here is to add value to the community through art programs, wellness, and focus on social determinants of health. We believe that all people have the right to flourish and grow in their communities. We also am launching the Brace Incubator, Art Incubator, which is educating the local artists about social determinants of health, help building the foundations for them and their families. And with that, we're also gonna, again, collaborate with organizations that are educating on business, right? How to form an LLC. Our little piece here is to educate them on access to care, how to open a bank account, right? How to purchase a house. Those things, which a lot of these artists might live paycheck to paycheck, and really their art is their livelihood. And here at Fridas Garden, we provide the education and resources for them if they need any help, like access to care. We have physicians that are near Fridas Garden that we will help them make appointments for them and their families. But yeah, Fridas Garden is definitely a safe space. I feel it has the trust of the community, including the artists. It is in an underserved area, and we do a lot of amazing work in the community here.
Thank you so much.
Thank you for asking about that.
Yeah, thank you for sharing that, Petra. One of the questions is that, do you ever get overwhelmed by all the obstacles we face in making an impact?
Can you ask that again? I'm sorry.
So do you ever get overwhelmed by all the obstacles we face in making an impact?
Well, I have to say, COVID was a hard hit, and I know it's a hard hit for everyone, not only from LatinaStrong as an organization, but owning a business like Fridas Garden. So I felt the pain through what it is to be a small business owner. because we were barely just kicking it off. Fridas Garden's only been around for 2 years, and it was during the pandemic. The other obstacle that we have is LatinaStrong. I would say at least 5 of our board members are on the front line, and we are a working board. So, we all have families at home, and we had to be mindful of family's always first. You got your health, you got your family, you're trying to juggle and balance life professionally and at home. So that has been really tough for all of us. And I still feel we still have some issues, right? But we like to help each other out and address them. Again, what I do, I have been always in a position to continue to do what I'm passionate about. I am surrounded by phenomenal people like all of you. And okay, maybe I don't sleep, but I love what I do. I love the community, and whatever I can do to add value and help people, that's who I am, and that's what I'm here for.
So, and just to finalize, I want to mention that also medical students has been very active in all of this process. So they have been participating. The Latino Medical Student Association chapter of the University of Arizona has been participating a lot in the activities in conjunction with NHMA and LatinaStrong. So there is an opportunity for teaching the medical students on how to be proactive in our communities. So thank you so much, all of you, for sharing your different perspective today in our panel. It has been really inspiring, as I mentioned. It's to see how people can change their own communities. We come to this world to change something. We don't have to change big things. We can change small things, and that's the achievement of the human. So to finalize, really appreciate your time, Annabelle, Hector, and Petra, for sharing your experience, the time of all of the participants, the time of the ones that are going to be looking at this. I know that, Hector, you have something to say.
Yeah, just real quick, Dr. Correa, before we hang up, I did put in the chat box just some more resources for everything that we're talking about. So I know it can be a lot, the information can be overwhelming, but I know, just given the fact that you're part of NHMA, you probably enjoy data sets, some reading, and just furthering your knowledge. And so what I put in the chat box is a website where kind of what Petra was talking about, a working board of folks that all come from different professions, that are CEOs of their businesses or nonprofit sectors, whatever it might be, but whatever skill sets that they have, they've donated their time to create different types of PowerPoint presentations from 5 minutes to 30 minutes with the most up-to-date information in every sector of work in the United States, specific to Latinx numbers. So there you can find the latest census data broken down in beautiful infographics and different data sets, and it's all completely free. That's the website there I wanted to provide for you all. If you ever need anything to share during a presentation, if you need different assets, infographics, whatever it might be, there is somewhere where you don't have to recreate the wheel. Someone's put the information out there for you to use at any time. And I just wanted to share that, and thank you all for making the time and space today.
Thank you so much. And it's important to mention that this is the contact information for the NHMA. Any question, you can direct it to NHMA at nhmamd.org. Please don't miss the next upcoming webinars that NHMA have, and also the upcoming Hispanic Health Professional Student Scholarship Gala that will be in California, November 18, 2021, and the NHMA 25th Anniversary Annual Hispanic Health Conference from March 24 to 27 of 2022, and this will be in Washington, D.C. So become an NHMA advocate for ending HIV. Here is some recommendations. Why to become an advocate is to represent NHMA and part of the NHMA PACT campaign in conjunction with the CDC to increase HIV awareness and prevention among Hispanic who are at high risk of HIV. What will this entail? Being sent CDC branded resources and flyers in your practice, for general distribution, opportunities to present on virtual events and conference, and participate in national and local events, and definitely connect with local CVOs to execute plans, testing drive. So there's a lot of opportunities in NHMA. So if you want to join, it's a great organization, and you can see how one organization joined other, and in Phoenix we are collaborating together to make our Latino community better. So thank you so much. Really appreciate your time, and see you soon.